Imaging in radiation therapy. Radiation treatments are very specific to each individual patient. Depending on the area being treated, there will be differences in the dose you receive or number of times you come in for treatment. However, a common similarity is that all patients receive imaging. The purpose of this video is to explain the reasoning behind imaging a patient throughout the course of their radiation treatment. You may be starting your radiation treatment soon, or possibly have already started, or might even have a family member going through treatment. This video is intended to benefit anyone who is questioning the reason why imaging is used prior to radiation treatments. You may wonder why there are green lasers in the treatment room. Once you are lying down on the table, the therapist will move you so that your tattoos or mask marks are aligned with the lasers. The lasers are used for alignment purposes only and do not deliver any radiation. By aligning all the lasers with your unique marks, we know that you are in the same position as you were during the simulation. Reproducing this position is important because this is what your treatment plan is based on. Once the therapists have aligned you to your marks, it is very important to hold still, as imaging is about to begin. Even though the outside of your body is now aligned, we also want to see what is happening on the inside. A common way we do this is by using a cone beam CT, also known as a CBCT. You might hear your therapist talking about this when they are getting you into position for treatment. It is simply a type of CAT scan that allows the therapist to visualize your internal anatomy. These videos show how a chest image is captured while the machine rotates around you. Imaging gives us the ability to overlay the daily image with your treatment plan. Your treatment plan was created using the images taken during your CT simulation. This video shows the therapist switching between images and making adjustments until they are a perfect match. Daily imaging ensures you are getting the most accurate and precise treatment, and sparing your normal healthy tissue as much as possible. There are two arms that will extend out of the machine. One is the imager, which is used to take the image, and the other is the imaging panel, which captures the image information. The machine will rotate around you as the image is being taken. Although it might come close to you, the imaging equipment will never touch you. After the image is taken, there will be a slight pause. This is when the radiation therapists are looking over the image and matching it to your treatment plan. Some days the matching process takes longer than others, so don't worry if one day seems like it's taking longer than usual. It could just mean the doctor is coming to verify the match is perfect. It's common for patients to wonder if we can see the tumor shrinking. However, the images we take are used for treatment accuracy only, and not for diagnostic purposes. After we match the image with your treatment plan, It is normal to feel the table move as we apply the shifts determined from the matching. You will need to continue to hold very still, as this means treatment is about to begin. Although the therapist won't be in the room with you during imaging or treatment, they will always be monitoring you with an audio and video system so that they can hear and see you at all times. Since the radiation is delivered to millimeter accuracy, it is important to continue to hold still because we now have you perfectly lined up for treatment. Once the images are verified, your treatment will begin. It is common for patients to be concerned about the radiation they are receiving from daily imaging. However, a cone beam CT gives a much lower dose than a diagnostic CT. The small dose you receive from imaging is accounted for in your treatment plan and is worth ensuring that the radiation is delivered exactly to where your radiation oncologist prescribed it. We know that cancer treatments can be very overwhelming, but we hope that this video answered any questions regarding imaging during your radiation treatments. We don't expect you to remember everything covered in this video. However, our hope is that you remember the following key points. Imaging benefits you by ensuring treatment accuracy and precision. CBCTs are a very important part of your treatment plan. The therapist can hear and see you at all times. And finally, your only job is to hold very still throughout the entire duration of your treatment. If you have any additional questions or concerns regarding imaging for your radiation treatments, please consult your radiation oncology team.